Good evening and welcome to this presentation. Today we're going to be discussing public health. The impact of public health and health in the community holds great importance. Without a properly funded and established public health office or organization to watch over and observe the actions of the personnel responsible for ensuring safe and ethical practices are established, follow without fail, and if fail shall happen, appropriate actions need to be enacted or responded accordingly, whether it be dismissal or retraining of the violator. Without this overseer and link to the public health, as has been observed in the past, all hell can be broke loose, as demonstrated during the Black Plague. Because of a poor health system, Europe was almost wiped off the map, and it can happen again without proper resistance and training. Role of community and public health. Community health centers have long served as an important health care delivery role for vulnerable populations. Community health centers across our country have a 45-year history of providing care in unserved communities for everyone, regardless of their ability to pay by design. These health centers are run by a board of directors comprised mostly of health center patients, ensuring the care delivered is tailored for the needs of the community they serve. Nonprofit healthcare organizations are not exempt from good governance. In fact, more today than ever, the hospitals and healthcare systems of this country must have the discipline and commitment to organize their governance structure and practice to provide forward-thinking leadership and stand up to scrutiny from any types of evaluation and review. As we move on from sick care organizations to healthcare organizations with accountability for the health, the population of our communities from birth to end of life, the role of governments becomes even more critical. Public health organizational structure. The public health system once was thought of as comprised only official government public health agencies, but now is understood to include both other public sector agencies. The structure of public health key components are mission, which is ensure condition in which people can be healthy. Structure. Structural capacity includes the following elements: information, resources, organizational resources, physical resources, human resources, and official resources. Process. Identify, address, and prioritize community or public-wide health problems and resources, and the output of these more fundamental processes: public health intervention policies, regulations, program, and services. And finally, outcome. The immediate and long-term changes experienced by individuals, families, communities, providers, and populations. Legal and ethical dimensions. Maintaining enforceable standards of ethical conduct, overseeing a financial disclosure system, ensuring the executive branch ethics programs are in compliance with laws and regulations, providing education and training to more than 5,700 ethics officials as well as executive branch employees, conducting outreach to the general public, sharing good practices with and providing technical assistance to state, local, and foreign governments and international organizations. There are many laws that have been established to meet the ethical needs of the patients, as well as healthcare professional in charge of cares. The most beneficial is the Sherman Trust Act of 1890, which prevents conspiracies to restrain trade among certain states is illegal, including such health issues as market competition, price fixing, and preferred provider agreements. In other words, it limits the creation of monopolies. Here are some of the laws that are dedicated to public health. As I spoke of before, the first one is the Sherman Act of 1890. The next one is Civil Rights Act of 1964. All individuals, regardless of race, color, or national origin, living in the United States will have equal rights, including admission to a medical facility for treatment. The next one is the Privacy Act of 1974. This law is intended to safeguard all individual privacies from the misuse of federal records, which include those under Medicare, Medicaid, and other government health care services. Next one is Emergency Medical Treatment and Active Labor Act of 1986. This law ensures that all individuals seeking medical treatment in the event of emergency will receive it regardless of the ability or means of payment. Next is Ethics in Patient Referral Act of 1989. This law prohibits doctors from requiring the use of specific laboratories for testing based upon a prior financial agreement or arrangement. Next is Patient Self-Determination Act of 1990. The law ensures that patients are informed of their rights before receiving care. This law extends to end-of-life decisions as well as routine examinations. Second to last is Health Insurance Portability and Accountability Act of 1996. This law increases the privacy of all medical health records in all forms, electronic, paper, and verbal. And finally, we have the Sarbanes-Oxley Act of 2002. This law, which came about after the Enron scandal, requires top executives from public corporations to account for the corporation's financial statements. This is all of the laws, but this is just some of them. Alright, let's continue. Funding of public and community health services. Health departments generally receive the largest percentage of their federal revenue from the United States Department of Agriculture, followed by the Centers of Disease Control and Prevention, the Health Resource and Service Administration, the Environmental Protection Agency, the Food and Drug Administration, and finally the Department of Homeland Security. Some health departments reported receiving no funding from DHS, which is Department of Homeland Security. State general funds are an important source of revenue for states' health departments, as they typically serve as a flexible source of funding. State health departments in this study tended to use general fund money to finance areas not covered by categorical funding streams, such as infrastructure activities and administrative costs, or to support programs whose costs are higher than their dedicated revenues. Next is communication in community and public health programs. Before we get into communication, let's review what the definition includes. Healthy People 2010 defines health communication as the art and technique of informing, influencing, and motivating individuals, institutions, and public audiences about important health issues. Public health communications draw from numerous disciplines, including mass and speech communication, health education, marketing, journalism, public relations, psychology, informatics, and epidemiology, although it is a transdisciplinary in nature. And these are the resources that I found all this information for. Hope you've enjoyed yourself and hope you learned something. Once again, my name is Jared Powell. Thank you for being a part of this. Goodbye.